this is The Place with Dave Nemeth and Brooke and Brittany Graham.
Hey everyone,
right back. Coming up next on the show, we are talking about colon cancer awareness month and what you need to know right after the break.
All right, everybody, welcome back. We want to talk about something fairly serious right now, and it doesn't have to be. We're here with Dr. Josh Vandersteen, and here from Ogden Clinic, and we're talking about colonoscopies. All right, nobody likes to talk about it, but it needs to be discussed.
It does, and you know, this topic is actually personal to me.
Okay.
My grandparents, I have two grandparents that died of colon cancer.
Oh my.
The whole reason why I decided to even go into this field.
Does it run in families?
It does.
Colon cancer, it does. Okay.
Yeah.
So obviously, if you have a family history, that's one more reason to get out there and have this
Correct.
done. Okay. Now I've had two. I'm 58 years old. I've had two, and I can just say, not a big deal at all. The preparation is the worst. It's not a big deal, and the fact that it's really kind of a silent disease, you've got to be proactive.
Exactly. Everyone says the night before is the worst part of it.
And it is.
We just have to, if we can get a good look inside your colon and get you cleansed out, it'd be great.
Mm-hmm. And really, it's one of those preventative things that literally can eliminate the possibility of you having a serious issue with colon cancer or any other kind of abnormality.
Right, like you alluded to, actually colon cancer in the early stages is silent.
Mm-hmm.
It's no symptoms associated with it, and then when you start getting the symptoms, it's usually in the advanced stages.
Right, right. So the ones that I had, they did find a polyp in the last one, and it wasn't just any polyp. It was one of the types that can actually turn to cancer, and so I'm glad I had it done, and I have to go back in a few years to have it redone, but I'm certainly not going to not go.
Exactly, and when we find those polyps and when we know that they are precancerous, we can actually shorten your interval and get you screened.
Yeah, now what are some of the symptoms that people might be dealing with to say, hey, I better go get this checked out?
Well, symptoms, like I said, symptoms usually there's no symptoms, but if you do have symptoms, change in bowel habits or even rectal bleeding,
okay,
then that could be an indication that you might have colon cancer.
All right, which is obviously a scary prospect. What can you do to prevent it besides discovering it and you know, being proactive on that front? Are there things that we can be doing as far as diet and what have you to help out?
Yeah, increasing your vegetables, always. I always teach about increasing your vegetables. Fruits and vegetables are very good at decreasing your rate of colon cancer. But the big thing is knowing your family history,
okay,
knowing your personal history. Did you get a colonoscopy? Did you have polyps? When did the doctor recommend you come back? Did your mom have colon cancer or polyps? You might need to be screened sooner.
So a family history, obviously very important. Age is also an important thing here. What age should people be getting their first colonoscopy?
Starting at 50.
At 50, and that's with or without a family history, or should you start earlier?
No, that's without a family history. Okay. With a family history, it may even be sooner than that,
okay,
40 or even younger.
Okay, well that's a good idea. And then also I would imagine those people need to come see you a little bit more frequently if they do have a family history.
Yes.
So
yes,
you need to be doing it, what, at least every 5 years?
Yeah, that's the absolute longest you can go is 5 years.
Okay, and doctor, how can people get a hold of you to find out more, to make an appointment, or to at least get a little bit more information from you?
So our website, ogdenclinic.com.
Okay.
All the information's there. You can just look under the provider tab.
Okay.
And all information on colonoscopy and the prep and everything is all right there.
Very important stuff. Needs to be done. You can't avoid it. It's one of those things,
yeah,
especially if you have insurance, you can save your own life. You really can.
Yeah, please get screened.
Okay, Dr. Vandersteen from the Ogden Clinic, thank you very much. We appreciate it.
Thanks for having me.
OgdenClinic.com. We'll take a break and we'll be right back.